in its path. And so where this cervix is in close location to obviously the vagina. And then you have the bladder, and then you have the rectum, and then you have all the tissue in between. So it can be, it's a very terrible cancer, honestly, to treat once it's spread. And so the key, as always, is to find early. And when found early, you can essentially cut it out from the cervix or actually remove the uterus, which includes the cervix, and could cure the person. Because usually if you find it early enough, it hasn't had the time to spread. Some cancers spread very quickly to the lymph nodes, and you still worry about chemo. But cervical cancer, sometimes you've caught, in the early stage, a hysterectomy or a surgery on the cervix to remove the part of the cervix that contains the abnormal cells, can be curative for a patient. So, what are some risk factors? HPV related, because human papillomavirus is sexually transmitted. So early onset of sexual activity, multiple sexual partners, having a high risk sexual partner where you yourself are okay, but your partner, is out there, he or she is in the streets, they could bring back stuff to you, unfortunately. And then you have, previous exposure, the STIs, that goes with sexual behavior as well. For some reason, early age at first birth has a relationship, and I think it has to do with, again, sexual behavior. If you're having sex at an early age, you unfortunately could have an unintended pregnancy. Most people who are younger than 20 aren't planning to get pregnant, and so that's where that comes in. And then immunosuppression, this is big. HIV population, because of the nature of the HIV virus and how it affects our bodies, it can suppress your immune system and then allows the HPV to proliferate more than it needs to, and that can increase your risk of having those changes in cervical cancer. Non-HPV related, everything kind of ties to each other, but cigarette smoking is a big one. I mean, smoking cigarettes does nothing good. I'm yet to find a positive. Obviously, people like the nicotine and it relaxes them, but really, in terms of your health, there's nothing good that it does. So if one has such a habit, if you could please start by cutting back, it would help your overall health. Non-white race has been a risk factor, lower socioeconomic status, which again ties in with some of these other HPV-related factors. Oral contraceptive use. For this one, there has been some relationship. Circumcision, for those who are not circumcised. So most of us in our culture, this is a mostly Nigerian crowd, males are circumcised. But in cultures where circumcision is not done, the uncircumcised penis can have a higher predilection for HPV, and such, you may see more warts and a higher risk of HPV-related changes. Signs and symptoms. Early cancer, usually you don't feel or see anything. Sometimes we see something on an exam, and usually we would take a little piece of it and send it to the lab to be tested. But other things to look for, if you notice that you were having irregular bleeding, if you were having bleeding after menopause, if you're having bleeding after sex, those are things to look out for. An abnormal dischargeal order, look for that. Advanced disease tends to come with a very abnormal order, pelvic pain, pelvic pressure, difficulty with urination or passing stool. But oftentimes at this point, people know that they have a problem. So what can we do? There's a vaccine, and this is the only vaccine that prevents cancer. However, this vaccine also has a lot of political drama surrounding it, at least in the US. I look at it like this. Your child is getting vaccinated for measles, mumps, rubella. They're getting vaccinated for hepatitis B. This is just another vaccine. But what you're doing is you're protecting them against the different strains, the high-risk strains that have been identified of the HPV virus. So male and female, should be vaccinated because our girls are not being exposed to HPV by themselves. They're having sex with boys. And so if the boys are vaccinated, then they're also equally protected. And maybe we can, down the line, make this thing a thing of the past and eventually suppress those high risk strains enough that it doesn't cause cancer anymore. The vaccination has also been extended to initially, ideally, you do it age 11 or 12. And the reason for this is to do it well before their first sexual exposure. Obviously, we don't want our children to be engaging in sex early and should delay intercourse for as late as possible. But you want to do it in that age group. And if you don't do it, they can still be vaccinated up until age 45. It goes for males and females. This is not just a female problem. Regular screening with cervical pap smears and pelvic exams. It's recommended once a year. If you are sexually active, it's also recommended to have sexual disease testing at least once a year. If you're in a stable monogamous relationship, you may not have to do it as frequently, but at least having your pap smears, having your exams done is useful. If you smoke, please try not to smoke. If you decide to have multiple sexual partners, at least use condoms. Condoms do not completely protect against HPV because of the way that the virus is, but I think it would limit in some ways. But the best thing to do is not to be sexually promiscuous.